Now we will listen, and it's with a great pleasure that I welcome Lindsy Frazer-Green, who is a guideline methodologist, and she works as senior manager of clinical methodologist for the American Academy of Dermatology, and she provides scientific and methodological support for and leads the development of treatment guidelines for skin disease, and she will explain how skin reviews are used to draw the guidelines of the AAD. Thank you very much, Lindsy.
Thank you. I hope you can see my presentation. Great. Thank you for this opportunity to highlight the collaborative process between the American Academy of Dermatology and Cochrane Skin in developing evidence-based dermatology guidelines. I'll outline how systematic reviews have become the cornerstone of the AAD's guideline development methodology and showcase 3 successful systematic review collaborations between the AAD and Cochrane Skin in support of our guideline development efforts. We'll explore both the challenges we've encountered and the significant benefits this approach has delivered, demonstrating how this partnership contributes high-quality, more reliable clinical guidance for dermatologists worldwide, while helping to translate Cochrane's rigorous research into everyday practice. A little about the AAD to set the stage for this discussion. Founded in 1938, the AAD is the largest dermatologic association. With a membership of over 20,000 physicians worldwide, the AAD represents virtually all practicing dermatologists in the US, as well as a growing number of international dermatologists. Our diverse membership includes board-certified dermatologists, of course, as well as residents in training, fellows, and affiliated health professionals who contribute to comprehensive skin care. The AAD's mission is threefold: to advance the diagnosis and treatment of conditions affecting the skin, hair, and nails, to advocate for the highest standards in clinical practice, education, and research in dermatology, and to support and enhance patient care. In concert with its mission to advance the treatment of skin disease, the AAD maintains a portfolio of clinical practice guidelines, currently addressing 9 conditions and care domains, with plans to add additional conditions actively underway. The landscape of dermatological treatments is constantly advancing, as we've heard throughout the presentations during this conference. Consider the evolution of psoriasis treatment we heard a bit about earlier. 20-some years ago, our most effective systemic therapies were broad immunosuppressants with significant side effect profiles. Today, we have several targeted biologic therapies. Similar advances are occurring in atopic dermatitis, HS, as we just heard, and other inflammatory conditions. This rapid therapeutic evolution creates both opportunities and challenges for guideline development. Clinicians need timely evidence-based guidance to navigate the increasingly complex treatment landscape, which requires recommendations based on the most current and comprehensive evidence available. As the leading dermatology organization in the US, the AAD plays a pivotal role in establishing clinical standards that influence practice patterns globally. To illustrate this impact, let's consider our guidelines on biologic therapies for psoriasis management, published in 2019. These guidelines have been cited over 700 times in peer-reviewed literature and have been referenced in 31 policy documents worldwide, including policy bulletins issued by the Canada Drug Agency, clinical practice guidelines in Uruguay, and treatment policy documents in Saudi Arabia. The far-reaching impact of AAD guidelines makes their currency and credibility of paramount importance, and maintaining up-to-date guidelines across the spectrum of dermatologic conditions presents significant challenges. Recognizing both the reach of our guidelines and our commitment to advancing evidence-based dermatology, the AAD has undertaken continuous efforts to refine and strengthen our guideline development methodology. The most significant change occurred in 2019 when we transitioned from the narrative evidence review-based strength of recommendation taxonomy methodology to the internationally recognized grading of recommendations, assessment, development, and evaluation, or GRADE for short, methodology for guideline development. As mentioned, the SORT methodology relied primarily on narrative reviews and expert consensus with limited systematic evaluation of evidence. GRADE, in contrast, provides a transparent systematic framework for rating the certainty of evidence and moving from that evidence to clinical practice recommendations. Specifically, rather than relying on narrative reviews, GRADE requires comprehensive systematic reviews. These reviews are then used to transparently develop recommendations through a structured evidence to decision-making process, requiring explicit consideration of benefits and harms of an intervention, patient values and preferences, resource requirements, feasibility, and other contextual factors that play a large role in clinical decision-making. The transition to GRADE presented significant implementation challenges for the AAD. We needed to develop new infrastructure for structured evidence synthesis, recruit and train methodologists capable of conducting rigorous systematic reviews, and educate our membership and guideline development panels on the new methodology. But perhaps most significantly, we needed to establish partnerships that could provide the systematic review expertise essential to grade-based guideline development. As is evident in this process diagram and my description of grades so far, systematic reviews serve as the foundation of grade-based guideline development. High-quality systematic reviews provide the evidence base from which all subsequent steps in the guideline development process and ultimately the recommendations flow. The collaboration between AAD and Cochrane Skin emerged from our methodological transition, driven by the AAD's newfound emphasis on implementing rigorous guideline development processes and Cochrane Skin's mission to provide high-quality evidence synthesis for skin disease management. The impetus for this specific partnership was our recognition of shared objectives. Both organizations are committed to using high-quality evidence to support evidence-based health decisions. This alignment of mission and methodology created a natural foundation for collaboration. Our collaborative process leverages the complementary strengths of both organizations. Cochrane Skin brings, of course, internationally recognized expertise in conducting rigorous systematic reviews, adherence to the highest methodologic standards, and a global network of research collaborators. The AAD contributes deep clinical expertise, understanding of real-world practice needs, direct connection to practicing dermatologists, and established infrastructure for guideline development and dissemination. Specifically, the AAD prioritizes topics for guideline development, convenes multidisciplinary expert panels, including patient partners, and formulates specific clinical questions aligned with the guidance needs of our membership. Cochrane Skin then leads systematic review efforts on these identified topics, supported by AAD funding and clinical expertise. The AAD subsequently integrates these systematic review findings into our established guideline development methodology, ensuring the final recommendations are both evidence-based and clinically actionable. In practice, the process of moving from a systematic review to clinical practice recommendation is as follows. The multidisciplinary guideline panel reviews the evidence from the Cochrane review that has been assessed for certainty per the GRADE process. The panel weighs the benefits and harms of an intervention per those findings in the review, alongside other important factors that I've mentioned previously, such as patient values, practical considerations, and resource use. Based on this balanced judgment, recommendations are formulated as either strong when desirable effects clearly outweigh the undesirable effects, or conditional when the balance is less clear or may vary by context. Throughout, transparency in how the evidence and judgments lead to the recommendation is documented, so that healthcare providers can understand and trust the guidance or interpret the findings for their own context. This structured approach ensures that clinical recommendations are transparent, evidence-based, and explicitly account for both the strength of the underlying research from the review and the practical considerations that influence real-world clinical decision-making. This collaborative model has been realized across 3 distinct guidance projects to date. Our first collaboration with Cochrane Skin focused on phototherapy for atopic dermatitis management. The AAD had identified a need to update our guidelines on phototherapy and systemic therapies for atopic dermatitis, recognizing that existing guidance was outdated in light of emerging evidence and new treatment options. Cochrane Skin had previously completed a systematic review on phototherapy for AD, but this review was several years old at this point and required updating. The AAD recognized this as an opportunity to support Cochrane's efforts to maintain current reviews while simultaneously obtaining high-quality evidence synthesis for our guideline development. Cochrane Skin completed the update to their review with support from the AAD, and it was then used for the development of a recommendation in the updated AAD atopic dermatitis guidelines published in 2023. Similarly, in 2024, the AAD identified a need for guidelines on the management of hidradenitis suppurativa, or HS for short, a novel topic in the AAD's guideline portfolio, and as we just heard, an area where there are a lot of treatment options and need for guidance. After engaging a multidisciplinary expert panel to define the research questions to establish the scope of the AAD's HS guidelines, we engaged and supported Cochrane Skin in completing a systematic review of the evidence for pharmacologic, surgical, and procedural interventions to manage HS. A novel feature of this review is the inclusion of non-randomized or observational evidence. This completed review is currently being utilized to develop comprehensive guidelines for this challenging condition, addressing an important gap in clinical guidance. The Cochrane Skin review directly contributed to the development of over 15 recommendations that will be included in the upcoming guidelines. The third completed collaborative effort was focused on systemic psoriasis therapies. We heard a bit about this topic at the start of this program. This project was built upon Cochrane's living systematic review process to ensure the most timely evidence was available to support the AAD's ongoing efforts to update guidance in this area. The review commissioned by the AAD also incorporated additional outcomes of interest, key to the expert guideline panel's consideration of factors that they felt were essential to making therapeutic recommendations in this area. The review is currently being used to develop recommendations for an update to the guidelines on the use of systemic therapies for psoriasis. The benefits of the use of Cochrane Skin reviews to support AAD guideline development extend across multiple dimensions. Most fundamentally, having systematic reviews that meet Cochrane standards significantly enhances the credibility and rigor of AAD guidelines. The Cochrane brand, as we all know, represents international recognition of methodologic excellence, and this association reinforces the AAD's commitment to evidence-based practice. From an operational perspective, this collaboration allows the AAD to develop guidelines more efficiently. By outsourcing systematic review efforts to Cochrane Skin, AAD staff can support multiple guideline development projects simultaneously, increasing our overall guideline production capacity without compromising quality. Perhaps most importantly, this process facilitates effective knowledge translation from research to clinical practice. By integrating these reviews into AAD guidelines, we create actionable, clinically relevant guidelines that practicing dermatologists can readily implement. While these projects have been overwhelmingly successful and beneficial, the process did bring to light a few challenges. Specifically, coordinating timelines between Cochrane's thorough review process and the AAD membership's expectations for more and more timely guideline updates. To address this challenge, we intend to implement the following: earlier engagement in the review topic prioritization and improved communication with members and leadership about the time requirement for rigorous reviews. A second challenge has been optimizing the engagement of clinical expert and patient partners in the systematic review development process. Traditional systematic review methodology can seem distant from clinical practice, and we found it important to ensure that the clinical experts engaged by the AAD to develop guidelines